Catonsville Pharmacy has been an institution in this Baltimore suburb for decades. For owner Neil Laycock, pharmacy is a family tradition that goes back generations.
Well, my father was a pharmacist, and he was an independent pharmacy owner. I saw what he did. I worked at independent pharmacy owner, other stores since I was 16, and I really thought that was something that I really wanted to do. So I continued doing that through high school and college, pre-pharmacy, and it's where I've been for the last 25 years.
And pharmacists have been providing care to Catonsville residents, like Doris Palza, for more than 40 years.
They say, "Hi, Miss Palza, how are you?" And I order my medicine, and I sit and wait for a couple minutes, then I get my medicine.
In Maryland, pharmacists take their medication education into assisted living centers.
Maryland law requires that anybody in an assisted living home that's on 9 or more medications have a med review, at least every 6 months, by a pharmacist. They can have other med reviews by nurses, doctors, but by law it has to be a pharmacist every 6 months. So we made this decision, my wife and I, a couple years ago when we split off our long-term care from our retail pharmacy, that this is what we were going to specialize in. So we have our clinical pharmacists that go out to our assisted living homes, that we service their patients, and we go out and look at their med reviews. We look at the chart to make sure things look correct. If there's any issues, we fill out forms, we talk to the nurses, we fax the information to the doctors, so that way we can get things corrected.
These pharmacy education classes help seniors understand their medicine.
I had the opinion in the back of my head, I don't really need to go. I know all about this. I have high blood pressure. What am I going to learn? But I went, and I've been to several classes, almost every single one that they offer. And I have learned something new at each class that I thought I already knew everything. And that was surprising to me and helpful to me. The things that they tell us might not seem important, but if you have high blood pressure, you take it to heart. It is important.
Patients recognize the value that pharmacists bring to the entire healthcare team.
I came to get very close with the pharmacy in our building, and I know how important they are, not only to the patients, but to the doctors as well, and to the staff. And if we call the pharmacy, we got an answer in a second. So I know how helpful they can be, not only to the patients, but to all the medical community.
So let's give pharmacists the recognition they deserve.
Pharmacists deserve provider status because we are in the community. Patients see us 2, 3, 4 times a month. We have the knowledge. We've gone to school to learn about medicines and other things that can help the patient live a better life. We can collaborate with the doctors and nurses, not trying to take over what they're doing, but just to be an added benefit to give them an extra eye on what's happening in the patient.
My pharmacist makes me feel confident, and when you're older, that's what you need. You need to trust what he's telling you and not have any questions or any doubts. And that's the most important thing, I think, to a senior citizen.
My pharmacist makes me feel like I'm family to them. I do. I really do.